I'm Claudine Wong, joining you from the San Francisco Bay Area, and I have Dr. Caitlin Simpson with us with Footprints to Recovery, the National Director of Clinical Operations. Dr. Simpson, thanks so much for joining us for this broadcast as we have a very important discussion about people in recovery and who are going through treatments and who now are finding themselves with even more challenges, right?
Yes, absolutely.
So tell us about Footprints to Recovery, where you're located and what primary services that you offer.
Sure. So Footprints to Recovery is located in Hamilton, New Jersey, Centennial, Colorado, and Arlington Heights, Illinois. We offer outpatient treatment Monday through Friday, 9 to 3, and also in the evenings from 6 to 9 for people that are struggling with addiction. Most of our patients do also come to us with an underlying mental health condition, and we have the capacity to effectively treat both for our patients.
Okay.
So right now, treatment's been a little weird because so much about treatment is connection with others and sharing life experiences and being engaged in group therapy and individual therapy. So it's definitely been a difficult time with everything with COVID-19 and how treatment has started to shift as a result from that.
Right, because I imagine are all your centers basically shut down in shelter in place situations within their states?
Mm-hmm. Each one, we've transitioned all of our programming to telehealth. So we're offering all of our services via video chat, telephone services, all through HIPAA compliant teletherapy platforms. So
And how is that going? I mean, it's obviously not ideal. A lot of what we're doing is different than we've ever done it before. But there's a lot on the line, in terms of folks and what they're suffering from and what they're trying to get through. How is the telemedicine working?
So it's working. It was definitely a challenge to roll out because we had to move a lot quicker than we would typically do to roll out such a large program like that. But we wanted to make sure that our patients still were able to receive the addiction in and of itself is a national public health crisis. Overdose deaths are one of the leading cause of deaths in our nation.
Mm-hmm.
So we needed to be able to still have a forum that we could still provide therapy, group therapy, individual therapy, make sure that our patients are still able to see their prescribers. We have psychiatric nurse practitioners on staff as well to help manage their psychiatric conditions. So making sure that that stability of care stayed in place was really essential for us as an organization.
Has it been successful though? I mean, when you talk about medications, you have to work not just with your own people within your space, but medications and things like that and other providers. It's a lot of, like you said, it was a lot of coordination. I can't imagine if they were telling you, hey, you have to do this, how much time do you need to roll it out? How much time would you have asked for?
Just a little bit longer than the time that we had,
Right.
but it was an all hands on deck situation. We have a great team at Footprints, so we were really able to operate efficiently and get this rolled out for our patients. And so far, it's going pretty well. Some minor technical difficulties, which I think we would have had regardless of how we were rolling out or timeframes of rolling it out. But we've been able to and we're actually still able to take new admissions as well. So
New
new
admissions,
patients
yeah.
have been coming through our doors. We've been able to get them enrolled in treatment and continue the services that they need.
Which it makes me wonder, right? If you have someone who is a year into recovery or 2 years into recovery or has been on a program to deal with mental health conditions for a while, so some kind of pattern has been set up, that are they better equipped to kind of handle this bump than maybe someone who was just starting to kind of wrap their life and their mind and their, logistics around managing the challenges that they're dealing with?
I think people in early recovery definitely have an added layer of challenge because during that time, they're establishing what their sober support network looks like. They're learning, how do I stay in recovery? What does my relapse prevention plan look like? Who do I turn to when I don't feel right and I might need help today because I'm uncomfortable about the situation that's happening? And even learning just to manage the anxiety and some of the emotions and the stress that is correlated with what's currently happening with the coronavirus is challenging. So then you
Mm-hmm.
factor that in with recovery in general in such an early period of time for them can be very difficult.
Right, I would imagine, because depending on people's circumstances, depending on where they are sheltering in
Mhm.
place and how much freedom they have and how much they used, maybe they used a walk to um, to kind of clear their space. And maybe that
Sure.
walk is now more stressful because now you can't walk near people, and now you can't go to the store, and now should I be wearing a mask? And it adds to that. Are you seeing that really added layer of stress also on all your clients?
Absolutely, because we tell all of our patients all the time, don't isolate, talk to people, get out there, go to an AA or an NA meeting and connect with other people. And now it's so counterintuitive because all of the messaging is stay at home, don't connect with others, stay in place. And it's completely opposite of everything we always tell them to do. So it's being creative and finding different forums to help us stay connected, not only through treatment and their therapy services that they're receiving, but how do they stay connected with their sober support? So online meetings, we're encouraging them just pick up the phone and talk. And right now, we're so grateful for technology because even though we used to always think, okay, well, let's not use technology so much. Now it's such a blessing because, hey, you
Mhm.
can pick up and you can FaceTime. And if you
Yes.
really need to see, your friend or your husband or your wife or your kids, and you're far away from home because you're in treatment, well, you can pick up the phone and you can FaceTime with everybody to keep that level of connection. So any way that we can stay connected and keep those forms of communication open is what we're encouraging our patients to do.
Are people struggling to reach out? I mean, I think it's hard to ask for help, whoever you are in whatever situation. It's hard to admit that maybe this is where I need more help than I want to admit that I do, or that I even maybe realize I do. Are you having trouble getting people to just reach out and do that in a new way because they had the meetings, they had the other things that were kind of more
Mhm.
understood and more of a pattern or routine?
I think for the people that are already engaged in treatment, it's a little bit easier because they also have us reaching out to them. But for the people that haven't engaged in treatment yet, that are still struggling outside of having services attached to them, I'm sure they're having a very hard time picking up that phone and asking for help, and that it's a lot easier to stay within the patterns of their addiction at this moment than to seek treatment and receive services.
Yeah, I mean, you mentioned though that you are talking to new people.
Mhm.
You are getting new clients coming in who are saying, "Okay, this is more than I can take," or "I've recognized that I have an issue that I need to address." Is that what you would recommend for it really kind of that it is that first step, right? Is that first step of reaching
Mhm.
out and saying, I need help. Um, do you expect to see more of that? Do we need to encourage more of that? How do we look in on the people that we care about who may be struggling? Because I would think if you had a substance problem with a substance that you could easily get, and you're in your house all the time, it could end up exasperating a current problem.
Mhm. We encourage anyone that has a loved one that's struggling with addiction or a family member or a friend to reach out to them and offer the support, and to always pick up the phone and let people know that they're there for them and that they care about them and they want to help them get the support that they need. Because help really is only a phone call away. And if they're not comfortable to pick up the phone, I mean, for Footprints to Recovery, you can log on to our website, which is simply footprintstorecovery.com, and we have a chat message. You can click on the chat if you're not comfortable to have the conversation over the phone. So there's different ways to connect and to reach out for help. And I think again, it's all about communication and how we keep those lines of communication open to make sure
Mhm.
that people can still call and ask for the help when they're ready for
As we go further, though, I mean, the really difficult part about all of this, besides the what's in front of us now, which is obviously a lot already to take, but the uncertainty about the long term is also really complicated, right? If someone told you, okay,
it.
Dr. Simpson, you got to do this for a month. And
Hmm.
after a month, we go back to what we knew to be true and what we knew worked, then that would be one thing. But I don't know if anyone's giving us that time frame anymore. I mean, certainly that was the hope, but I don't think that realistically we're seeing that. Does that change how you look at the long-term care of folks too, and how you, when you're doing your clinical operations, how you now reset that into a place where it'll last until spring of 2021 or fall of 2021, or when it is safe, even if they open things back up, to put people in a big meeting? How does an A meeting look different, or an NA meeting look when we have all these concerns about social distancing still? How does it all change?
Sure. I think definitely part of our aftercare planning process has changed. We've slowed it down a little bit to make sure that the plans are appropriate and in place for everyone because not everybody has the ability to go home. Maybe they came to us from Tennessee and it requires hopping on a plane, which is not an ideal,
Mhm.
method of travel
Yes.
right now. So we're taking some extra steps on our end to make sure that the aftercare plans for our patients are appropriate.
Looks like I lost you
Be
really
different,
quickly.
and
Oh,
who
there you
knows
are.
what exactly that will look like, if this is going to change the way that that behavioral health care operates in general. I think that will, remain to be seen. But the one thing that won't change is that there's always going to be treatment. There's always going to be services that are here to help anyone that is in need, and they really just need to remember to pick up that phone and ask for help.
Yeah. The other issue that I think comes up is when we talk about a recession and we
Mhm.
talk about people losing their jobs and we talk about, you know, the amount of stress that goes on to the general population, how that will affect for those of, who are in your business of people's mental health and how we all handle that and come out of that. I would imagine that might increase your workload as well, even separate from corona. It's the corona impacts that also then impact all of us.
Mhm. I think you're going to see definitely a spike in people that are going to need access to mental health resources in general, just based on the nature of the situation of what's happening. Um, I mean, we're humans. We like to connect. We like to be around other people. It is very counterintuitive for us to isolate and stay at home and to not be able to go to work and function in a normal capacity. So I can imagine that people's levels of depression will increase, levels of anxiety will increase, regardless if there's an underlying mental health condition or not. Just based on the situation in and of itself, it's a challenging time. So I think we're definitely going to see an increased need for help and services for the regular population, but also for the healthcare workers. The level of stress that they're encountering day in and day out when they're going to work and the things that they're experiencing and seeing, they're going to need a good amount of support as well to be able to continue to function and to be able to continue to process and deal with all of the levels of stress that they've been dealing with on a daily basis. So I know that up in New York, Governor Cuomo had announced that they had, I think, 7,000 volunteers that were mental health professionals that were coming in to help support not only the healthcare workers, but all of the patients that were coming in and the people that were reaching out and asking for help. So it's really important that as a community and as a nation, we're all coming together to support everyone equally with the
Um,
challenges
uh,
ahead.
and how much, I mean, how much solidarity within, I've seen industries kind of come together. They are all talking and saying, okay, as a unit, how do we change or how do we best, rise to this occasion and meet the need? How much of that is going on within the recovery and mental health field of how people are talking and coordinating their efforts there?
I think each organization is coming to the forefront with different things and coming up with different ideas. First and foremost, about how we support our patients during this time to make
Hmm.
sure that we can to support the overall communities and the people that are really on the front lines doing some of this work. I mean, I can tell you just within our small team at Footprints to Recovery, we've been putting extra measures in place to support our clinicians because they have their own fears outside of work with everything that's happening. And we need them to come to work and to be healthy and to feel safe and supported because they're the ones that are providing care to our patients still and coming up with different measures about how you manage that level of anxiety within work. So I think each organization is probably managing things a little bit differently and coming up with ways to support their teams, the community, the patients, because each aspect of that operation needs the same level of support.
Do you still have group meetings online, like virtual, like support
Hmm.
groups that people can join in a big Zoom meeting from around where people can still get that group
Yeah,
feeling?
we have a teletherapy platform, so we still are conducting all of our group therapy sessions as scheduled. We had to modify our operations and our group sizes a bit to make sure that it was therapeutically appropriate for our patients. So the groups are much smaller now, so that we can effectively see everybody on a little screen and
Hmm.
everybody has a chance to speak. But we're still providing our groups, our individuals, as well as our medication management appointments as well.
Are you having any trouble with people who, I always joke with people, we didn't know Zoom 3 weeks ago, and now all of us, it's like the buzzword, right? Like we are learning very quickly about it, but you do find that it makes a technological barrier for some who, one, they don't have the internet, or they don't have the capability, they don't have a computer, or they don't have the ability to just hop on, and some people
Mhm.
do, or even to figure it out, because it can be a little bit more complicated for just the technical side of it.
Hmm. Yeah, some of our patients, especially some of our elderly patients that maybe aren't, so hip and trendy with modern technology, it's as simple as picking up the phone. So if someone isn't comfortable with the video aspect or with logging online to sit to a therapy platform and doing these things through video, we'll pick up the phone and we'll talk with them and support them and do therapy that way.
So however, we all can figure out the phone these days,
Hmm.
right? And so there's always
Yep.
that. We can get fancy, or we can stay simple. Either way, whatever
Whatever
to help you.
works.
Whatever works. I think that
Right.
is so important. And as it progresses, does it get easier? I think
Yes.
we want to learn how to do this the right way. We want to do it well. You have
Hmm.
people in need, and I think we're getting better at it. I'd like to think, out of necessity.
I think we're definitely getting better. Everybody adjusts, everybody learns. So that initial, oh my gosh, how is this going to work? How's this going to happen? Am I going to be able to see all my patients on the computer? After a couple times of operating with the teletherapy platform and being able to connect with our patients, it does get easier, and it gets easier for the patients as well. So slowly over time, it becomes our new normal, and we adjust and we continue to move forward.
And that's the life lesson, right? For all of us in general, that it gets
Yes,
better.
it
It
is.
gets better. It gets better together. And your
Yep.
best advice for folks. So whoever, if you are, I mean, I think it comes down to just reach out. There are people on the other end of a phone, on the other end of a computer. There are people there.
Yep, reach out, stay connected, keep the conversations open, and don't be afraid to talk about how you're feeling. Be open, be honest, and I can promise that if you share how you're feeling, most likely the people on the other end of the phone are going to have a similar experience.
Yeah, I think so. I was just talking to a friend. I'm like, let's get past the weather, because we're way past that right now. And let's just get
Right.
down to the nitty gritty. And at the end of that conversation, I think we'll all be better off if we just get down to it, because
Mm-hmm.
the struggle, especially now, is more real than
Yes.
ever. Yeah.
Yes.
All right. Well, Dr. Caitlin Simpson, what a great conversation. National Director of Clinical Operation Footprints to Recovery. I wish you the very best. Thank you for all the help that you do to help those in need, and especially in this very, very trying time. We
Yes.
appreciate your
Thank
time.
you. Thank
All
you for
right.
having me.
And for more on this, you could always go to coronavirusnow.com. That is where we have all the latest information on our 24/7 digital platform. Thanks so much for joining us.